Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Let's look at the CNS infections and the regions are commonly affected. To begin with, the tubercular meningitis. So the affected part is the basal part of the brain. Then comes the tubercular encephalitis. This is the intraparenchymal granulomas. Then the meningovascular neurosyphilis. This is the base part of the brain, meninges covering the cerebral convexities. Next is the paratic neurosyphilis. This will be the frontal lobe. It is present in the frontal lobe. Now looking at the tabes dorsalis, this is the dorsal cord. The dorsalis is the dorsal column of the spinal cord. The HSV encephalitis is the temporal and the frontal lobes. This will be the HSV encephalitis, temporal and the frontal. Then the varicella zoster infection. It involves the dorsal root of ganglia as well as the trigeminal ganglia. The cytomegalovirus is the choroidal plexus, the paraventricular subepithelial regions. Then the poliomyelitis. The poliomyelitis involves the anterior horn cells of the spinal cord. Now looking at the JC, that's the Japanese syphilis virus. So this is the oligodendrocytes. Then comes the rabies. So what about the rabies? It is the hippocampus cerebellum. This is nothing but the rabies. Then when you look at HIV, it is the subcortical regions. Then the aspergillosis or the mucormycosis. It involves the blood vessels. So blood vessel walls are involved, and there is a intraparenchymal abscess or the granulomas. Then the cryptococcosis, it involves the intraparenchymal abscess and the granulomas. Then the toxoplasmosis, it involves the cerebral cortex. It involves the CC, that is near the grey matter white matter junction. Then is the cerebral malaria. Cerebral malaria, it involves the blood vessels of the brain. To learn and grow daily like this, please do subscribe.